Okay, Dr. Reiner, and we're back, and I think we have Amy on the line. Amy, are you there?
Yes, I am.
Great. What can I do for you tonight?
Okay, since you have been discussing vaccines that people get, I was wondering what your opinion was of the pneumonia vaccine.
Yep.
Do you recommend it? Should people get it? What age should they start looking at it if they don't have any other respiratory issues? People that have respiratory issues obviously would get it sooner. And I'd just like you to discuss a little bit of that, and I'll leave now so that I can hear what you have to say on the air. Okay?
Great. Thank you very much. Yes, in fact, the pneumonia vaccine was the next one on my list. Actually, it was a hepatitis B vaccine and then the pneumonia vaccine, so we'll hopefully get to that really quick. Anyway, let's bring up the last slide that I had on the shingles vaccine. I want to make sure that one of the things that we bring up is that, again, look at that varicella zoster IgG, and it will not actually, in some cases, it doesn't always prevent the vaccine or doesn't always prevent the outbreak, but it will lessen the severity of that. Okay, let's bring up the next slide, which is the hepatitis B that we want to talk about. What they did change recently on that is that hepatitis B has been effective for a long time. And what we have found, what they started to do is that they updated the recommendations for diabetics who have not gotten the hepatitis B vaccine to get the hepatitis B vaccine. The risk for hepatitis B is twofold higher in diabetics compared to the general population. And obviously this is related to blood glucose monitoring and other procedures. And not only that, hepatitis B is very easily transmitted in diabetics greater than the age of 60. And again, that has to do with immunity and how well you can get that into your body. And obviously we did treat all healthcare providers. So that's an update in hepatitis B. If you're a diabetic and you have any other reason, you haven't gotten the hepatitis B vaccine, it's very important that you consider that. So all diabetics, especially in 19 to 59, should be given that vaccine if they've been diagnosed with diabetes. Okay, let's see if there's another slide on hepatitis B. I don't know if there is. Okay, we're going to go into the pneumonia vaccine. And Amy, this should answer your questions. Currently, the one that existed for adults was the polysaccharide version 23, Pneumovax, and it's been available since the 1980s. At that time, that vaccine was given every 5 years. Every 5 years up until the age of 65 and once after age 65. The very interesting, it's not likely to decrease the risk for pneumonia in older adults. Again, it is important for your body to be able to process that vaccine. And I didn't classify what older is, but in my case, it's usually anything past the age of 70. It's very hard for you to process any vaccine, no matter what that is. That's why you want to try and get those at an earlier age, usually between 60 and 65. And again, the other slide says may decrease the rates of pneumococcal bacteremia and mortality. So, and what that means is that if you have an infection and it does get into your system, that's called bacteremia. So again, that was the polysaccharide 13. Then they came up with, and you've seen on the news or advertising lately, is the Prevnar 13. Now, this is a different version of the pneumococcal vaccine, and there are a lot of strains of the pneumococcal bacteria, but they've isolated these particular strains. The Prevnar 13 was initially developed in the pediatric population. So that being said, they had a lot of experience with it, and then they started to do studies with it in the older population, and they found it to be very, very effective in the older population. So we'll go back, if you bring that slide up, there was some interesting data on that. Adults greater than the age of 65 with chronic pulmonary conditions, diabetes, liver disease, renal and splenectomy, and or immunosuppression, and patients with asthma, who smoke included are included in this 2008. So again, those are the indications for people. And you notice it says greater than or equal to age 65 with chronic pulmonary conditions. It's important that you get that vaccine at age 65 and hopefully continue it. Let's bring up the next slide. And so here it is, the PCV13 was highly efficacious in pediatrics, and now it's recommended for all adults greater than the age of 65. And it's also recommended as a single dose for adults greater than 19 years of age with immunocompromising conditions, people with a spleen removal or cerebral spinal fluid leaks or cochlear implants. And if you ever see anybody with a cochlear implant, these are people that actually have a little thing in their back of their head that helps them hear. So with that being said, this new vaccine got a lot of experience in the pediatric population. It's been very, very effective, and they moved it up to the adult population. So the rule of thumb is that if you happen to get a, let's suppose you recently went in to get a flu vaccine and you got the Prevnar, you got the polysaccharide 23, which is the common one, you should wait at least 6 months, okay, after that, a minimum of 2 months actually it's the other way around. If you've had the polysaccharide 23, you want to wait at least 6 months, maybe even a year to get the Prevnar 13. But let's suppose you've never gotten any of that vaccine. The first one you would want to get is the Prevnar 13. That's a very important vaccine. And then you would want to wait at least 2 months, hopefully 6 months, and come again behind that and get the polysaccharide 23. So again, remember that if you recently got the pneumonia vaccine, check and see which one you got. If you got the 23-valent one, then it's very important for you to wait at least a year before you get the Prevnar 13. If you hadn't gotten one, then get the Prevnar 13 and wait at least 2 months, hopefully 6, up to a year to get the polysaccharide 13 and that 23. That gives you the best chances of avoiding pneumonia by that. But that being said, even though you get this particular vaccine, you can still get a pneumonia because there are other causes of pneumonia other than pneumococcal. It's just one particular bacteria that lives in our upper airway. And anytime you get a cough or cold and you get that postnasal drip, it's going to drain down into your lungs. And so the ability to get a pneumonia is based on a bacteria that doesn't get oxygenated, and that can happen for a lot of different reasons. I mean, you can aspirate at night, meaning you could have dinner and go to bed late, and some of that reflux comes up into your your upper throat, and then that causes you to get some of that bacteria in your, and it causes all kinds of irritation, but that's called an aspiration pneumonia. And we see that a lot. So a word of advice here is making sure that if you do have GERD, not to eat really late, because that could always set you up for pneumonia. It is one of the things I look at for chronic cough, meaning the patient comes in and they're really not sick, but they got this chronic nagging cough, and I rule out that they're not taking an ACE inhibitor or some other medications known to cause a chronic cough. The other condition would be GERD or reflux, and again, I've talked about it in previous shows. If you just simply elevate the head of your bed, take a 2x4 block and use 2 of them and elevate the head of your bed where you're sleeping 4 inches this way, or if you can't stand that, even 2 inches, gravity is a great item to keep your contents in your stomach down, and there you actually breathe easier because your nose doesn't get congested when you lay back down. And patients tell me, oh, I sleep on 2 pillows. And I'm like, okay, that means you're on those pillows all night long. Well, unless you have a wedge pillow in your bed, you're not elevated all night long. A lot of people do a lot of tossing and turning during the evening hours. So that being said, that doesn't work. Viruses cause pneumonia. We just talked about a varicella pneumonia. We talked about other types of viruses that can cause pneumonia. These are not going to be treated with that. There are also other type of bacteria that you can get, Klebsiella, and other type of oral pharyngeal bacteria can cause a pneumonia. So it's not the panacea, but it is very important for you to eliminate as many causes of a potential deadly disease as possible. So that's one, I think if you were going to do anything, the Prevnar 13 and the pneumococcal vaccine would be good. The shingles vaccine would be very good. Again, I kind of jokingly say shingles is like a wish sandwich. And everybody says, well, what's a wish sandwich? Well, a wish sandwich is 2 pieces of bread and you wish you had some meat. Get the shingles and you wish you would have had the vaccine because it can be very painful. It can be a lifelong condition. It's very important to analyze those. There's also a pneumococcal vaccine, a meningococcal vaccine. A little bit more out there, would be more useful for college students and things of that nature, really not really in this population. When you get into that, that's a very useful vaccine because meningococcal is a very deadly disease, go to bed, wake up dead type of thing, and that's how deadly it can be, and it's a very it's a very scary thing because everybody who's ever been exposed to someone with a meningococcal meningitis, they all have to be treated with antibiotics because you have very little warning. It could be a flu-like symptom and you think it's a cold, and then you go to bed and, like I said, you don't wake up. So that's a very invasive bacteria, and again, it's a particular type of bacteria. So a lot of things out there, and it just brings up the topic of antibiotics again, which is the overuse of antibiotics. Some information I heard recently that ciprofloxacin and Levaquin, obviously, it's a very widely used antibiotics. I use it a lot in my practice, but it has been associated with tendon ruptures, especially when used with cortisone, and it also there is a higher risk of cardiac issues after using even Biaxin and Levaquin for more than 5 days at a time, and that risk seems to linger on for months afterwards. So we're going to go to break, and we'll come back. We will talk further on other topics, and again, I appreciate your call if you have one. Thank you.